Senator, I'm a baby boomer. In the next 15 to 20 years, I'm going to be retiring.
How old are you?
I'm 47. Trying to find out when I'm going to retire. And my wife is 42. She has multiple sclerosis. She's disabled. She collects Social Security disability income with some Medicare provisions. How, as President, are you going to assure that the Social Security fund and the Medicare fund remain solvent for me, for my wife, and for future generations?
Let me do Social Security. I'm trying to decide which one to start with. Let me do Social Security first. I can tell you what I'm against and what I'm for. What I'm against is privatization. I'm against cutting benefits, and I'm against raising the retirement age. What I'm for is creating a new revenue stream for Social Security. And I think the cap at $97,000 of income makes no sense. I mean, what it means to me is if you make $75,000, every dime of your income is taxed for Social Security. But if you work on Wall Street and make $100 million, which some of the hedge fund managers do, first 97's taxed, the rest is not. So what I would do is lift the cap, creating some protective bubble for people between like 97 and $200,000, so that millionaires are paying their fair share of payroll tax. That's what I would do about Social Security. Medicare's tougher because, and there are a variety of things we need to do that will make it better. I think universal health care is crucial because it clearly will drive down the cost of Medicare for a whole variety of reasons. Second, we need to have a medical home for people with chronic conditions in Medicare, which we don't have today. And because chronic health care costs account for way over 50% of the costs of Medicare. I forgot the exact number, but it's very high. And so we need a way to coordinate the care that people who have chronic conditions have. So we ensure, and it's not for being like an HMO. The idea is that you have one person that the patient can go to all the time who coordinates the services, the therapies, the if you need to go in the hospital, they'll arrange for that. And the idea is both to provide better care for the patient and to reduce costs. I do think that the Medicare prescription drug law is a disaster, and it is a perfect example of what I've been talking about the corruption that exists in our government. I mean, I was there when the thing passed. The drug company lobbyists wrote the thing, period. And as a result, there's nothing to control costs. And it's the reason the donut hole's so big. It's the reason the costs are so high. And I don't want to get off topic. I'll do this really quickly. But I think it is part of a bigger question of the choices that voters are going to face in this election. I mean, if you believe, even though I think some of the other candidates mouth the words change, if you actually defend the system and think it works, if you think it's fine for lobbyists to give millions of dollars and then lobby the people they're giving it to, if you think that the system is not in fact rigged, which I do, then you're not going to change it. And if you're not going to change it, the big changes that need to be made will never happen. And I think that connects directly, by the way, to the bigger question that I see in this election, which is this incredible rumbling that I hear across America from just good people, that they're worried their kids are not going to have a better life than they had. And this is like the great promise of our country. I mean, we've always done that 20 generations before us. And so I think these things are directly connected. And whether it's Blackwater roaming through with mercenaries in Iraq, or the Medicare prescription drug law, or trade laws that are giveaways to big multinational corporations, or I mentioned this last night, Walmart lobbying against inspected containers, whatever it is, it infects the whole system and is connected to almost everything. So back to Medicare. I think that what that means is we've got to get the power out of the hands of the few and back in the hands of the many. And that means on Medicare that we have to use the power of the government to negotiate better prices from drug companies. They don't want it, and they've effectively bought their position so that that the law is contrary to the interests of Americans. But it's the wrong thing for America. So negotiating better prices, doing much more to control drug company advertising on television, which is about twice as much as they spend on research and development. I would allow prescription drugs to be reimported from Canada. I mean, all those things are aimed at driving down costs.